It's been just over 3 years, 3 months since the Patient Protection and Affordable Health Care Act took effect in America. And so much has happened since. Children can't be denied coverage for pre-existing conditions, no more lifetime monetary limits on coverage, and the medical loss ratio became effective.
What that means is that for the first time, insurance companies are required to spend at least 80 to 85% of all the money they collect in premiums on medical care. If they don't spend that amount on medical care, they actually have to give rebates back to their policyholders.
And UCLA research scientist Shana Alex Lavaretta credits that provision with dramatically slowing the rising costs of U.S. health care.
Most of the opposition is now saying the news is not good enough, that healthcare costs are still growing, it's not dropping, but they're growing much less than they would have otherwise.
Significantly less for one segment of the population, young people under 26 years old. People like Ridwa Abi, a recent UCLA graduate who'll soon be headed to medical school.
People under age 26 could now go back on their parents' private plans, regardless of student status. And that one provision has been incredibly successful.
Under the previous mandates, after graduating, Ridwa would lose her student health insurance and could not be covered under her parents' policy. That is until the Affordable Health Care Act.
It's nice to have that safety net. A lot of people out there in the real world who don't have the advantage of being in school or don't have the access to education, they don't have the opportunity to have that insurance. So it is very comforting knowing if you have a parent that does have a stable job that can provide that for you.
Lavaretta says young people like Ridwa are the biggest winners in this healthcare lottery.
But Lavadera says there will be many more winners to come as more provisions become available. Soon, millions of uninsured people will receive health care coverage despite pre-existing conditions. Yakenda McGahee, CCTV, Los Angeles.